Hello all, I am Dr. Sai Phani Chandra. I am here to talk about a simple point which we all live with every day. Joint pain doesn't just limit movement. As a joint replacement surgeon, my goal has always been to give patients faster recovery, better movement, and long-lasting joints. That is why I have embraced robotics in orthopedics. That is ortho-robotics. Now, what is ortho-robotics? A robot which assists a doctor's arm. So I have two hands. If I need an extra arm, that is what is robotics in orthopedics. So my hand has a precision. Now, if I want to have accuracy and much more precision, I would want to have a robotic arm in my hand. Let us make it simple. If you have to travel from Karimnagar to Hyderabad, we know the route, but still we use Google Maps. Why is that? Because we want to know where is the traffic, where is the hindrance, where we have bottlenecks, is there in traffic jam, what is the time where, how much will it take for us to reach Hyderabad and all. So this is a simple analogy which we can also apply to how we use it for robotics. Now, for a given patient, we don't know how much laxity the patient is having in his knee joint or her knee joint. Once we quantify, we give a number how much the laxity is there for that patient's given knee joint. We can put a number on the monitor. That is the robot's arm. So then it will show that the patient has so much laxity on one side and so much laxity on the other side. So then we can exactly plan the cuts, how much do we need it. Because the more bone we cut, the more chances of going into revision and more bone loss when we do a revision surgery. So the principle in replacement is to preserve as much bone as we can, because when we go for revision surgeries, bone preserving is very important. By doing so, we balance the tissue tension and give the patient a better chance at recovery and a better life to the joint. Hence, ortho-robotics makes our life much easier for the doctor as well as the patient. The patients have been much happier, I must say, for the past 3 years wherein the robotics has started and we started doing robotics. I can assure you, I've done so many of my relatives as well, and so many patients who have gotten done one side conventional, they came back saying, yes, my other colleagues and friends have done robotic and I want to get a robotic on the other side. And they themselves can see the difference. The one with robotic and the one with non-robotic, the one which underwent through robotics, the patients are extremely happy. So what I want to say here is robotics is the future of orthopedic replacements, and I wish you all come get checked whether you suit for the robotic surgery or not and go ahead for the surgery. Thank you. This is Dr. Sai Phani at Swetha Sai Phani Clinics in Karimnagar and KIMS Hospitals, Hyderabad. Thank you.